Michael Imodu Institute for Labour Studies has organized a week-long training program for about 200 staff members of the National Assembly. This is in a bid to foster a positive work environment and promote harmonious working relationships within the National Assembly. Senior correspondent Sharon Ijason reports.
The need for workers' training and retraining was re-emphasized at this event. The training focused on work ethics, grievance settling, occupational health and safety, and awareness about labor laws and procedures for resolving disputes in the world of work. The Director General of the institution, Issa Aremu, in an interview says the exercise is aimed to encourage innovative approaches to address the challenges faced by the staff.
It's time for us to avoid polarization, avoid fighting, but it's not the time for dialogue to look at what the issues are. And I've no doubt in my mind that it's still not late for us to have protest. It's not late for government and labor to sit together. And this is what we are here for, to promote that capacity for negotiation, for compromises, as the case may be. But we can have a win-win solution. And on the last note, even the disagreements are also very healthy because it's about development.
The expected outcome of the program is a more cohesive and productive relationship between the staff and management of the National Assembly. This harmonious environment is believed to strengthen the democratic process, leading to increased efficiency and effectiveness in the nation's legislative arm.
The ministry is very, very excited at this innovation, and we are really impressed and happy with the institute, which incidentally happens also to be our agency. So it shows you the push that the ministry and the agency has towards bridging the gap and letting the relevant sectors in Nigeria, especially the National Assembly, on labor administrations and how to foster the kind of relationship that is going to make administration of labor along all strata to be very effective, harmonious, and progressive, because we want a progressive, safe and decent industrial relations and labor relations with Nigerian workers and Nigerians as a whole.
The National Assembly's Union, the Parliamentary Staff Association of Nigeria, plays a significant role in the advocacy for workers' welfare.
To Bayelsa State now, where the need to improve to provide social safety nets such as free healthcare insurance schemes to cushion the effect of the full subsidy removal on Nigerians has been emphasized. This formed the overriding theme of the Nigerian Medical Association conference in Yenagoa, the state capital. We have details in this report.
The removal of fuel subsidy by the federal government has seen a rapid increase in the prices of the commodity, from 180 naira to 570 naira per litre, an increase of more than 200% in the past few months. While experts believe the move is in the right direction, the surge in fuel prices has increased the cost of living and transportation, leading to the recent nationwide protest by the Nigerian Labour Congress. At a medical conference in Yenagoa with the theme, The Impact of Fuel Subsidy Removal on Effective Healthcare Delivery in Bayelsa State, medical experts exposed the adverse effects of subsidy on the health sector and prefers various ways such funds could be used for the benefit of ordinary Nigerians.
Giving palliatives, one-off palliatives to poor households, that is not sustainable. Rather, government should think about building social safety nets and social protection systems where every Nigerian is insured, so that every Nigerian do not need to bring money out of his or her pocket to pay for healthcare services.
There's need to improve awareness and knowledge about artificial intelligence. And this is a time we need to look at policy and legislation as regards artificial intelligence, especially in the health sector. Because if we do not regulate artificial intelligence, it will be misused and abused to the detriment of humanity.
While kudos are given to the state government for some laudable policies in the sector, more is expected to boost healthcare delivery in the state.
The new hazard allowance, okay, which has been implemented since late 2021, okay, and the doctors working in federal hospitals have been receiving this allowance, including our brothers and sisters in the Federal Medical Center, Yanagua. So we use this opportunity to request from the government to please implement this allowance for us.
The conference also serves as a platform for creating awareness of the need for more practitioners to be engaged in the medical field.